Well, it's overstated, but it's true. We are living through unprecedented times. Now, compared to other parts of the country, Arizona has been sort of in the middle of the pack in terms of cases, and here to talk about Pima County specifically is its Director of Public Health, Dr. Bob England. Doctor, it's a pleasure to have you on to talk about something so important and to see how we're doing here closer to home. And of course, one of the most unfamiliar parts of all of this is the social distancing aspect, having to stay 6 feet apart and stay in our homes away from, other families. What has physical distancing actually gained us, and should we keep doing it?
Oh, yeah, we absolutely need to keep doing it. And I know it's tough. I mean, after all, this weekend was Mother's Day. We have lots of instincts to go be physically close with others, and I know it's tough. What you're doing by physically distancing is keeping droplets from one person when they cough or sneeze or even just talk from landing on other people. It's literally that simple. And especially as we begin to reopen and return to some semblance of regular business activity and people are around each other a little bit more, especially now it's important.
Yeah, and I think you might agree, Arizonans have been extremely responsible and have reacted to this very well, and they're doing what they have to do. And a lot of them ask, well, we have all these measures in place. Why is the number of deaths actually still rising? What do you tell them?
Yeah, we're unfortunately going to continue to have cases and deaths for a while. So think of how you've seen those graphs either on TV or online, where back when this started, we were going on an upward slope. We put different mitigating factors in place, starting back in about mid-March and then adding them as they went. And it took 3-4 weeks before we plateaued off that curve. And now we're just gradually on the way down. So if we open up too fast, if we go back to our normal lives too quickly, not only will we increase transmission again, we'll be starting from a higher level. There are more people infected right now walking around than were when we started these mitigation measures. So it's like getting a running start, if you will, to the next wave. So if we don't adhere to physical distancing, if we aren't careful about washing our hands, if we go amongst each other too much too fast, we'll have another increasing wave. And one really key point to that is that you can't detect the effect of any change in mitigation before 2-3 weeks have passed. Because think about it, it takes a week just to incubate the disease, and it probably takes a couple of generations of spread, transmission from someone to others and from them to others, before we can see a change in that trend line. So whatever happens next week, from restaurants reopening, retail businesses reopening in some circumstances, and the like, we won't be able to detect until about the end of the month, maybe early June. By that time, our ability to detect is a few weeks behind. So we'll be further up the curve than we realize at that point. And then if we slam mitigation measures back on all of a sudden, it'll take 3-4 weeks for it to plateau off again, just like it did the first time around, except we'll be at a higher level. Now, I don't want to freak people out too much. There is a chance, and it's a reasonably good chance, that the virus will behave somewhat seasonally, just begin to slow down on its own because it's summertime. If that happens, that'll bail us all out. But I don't expect it to happen completely. So we are really in this for a long, long time. And we have to be careful that we don't reopen so quickly that we end up just extending this even longer than it has to be.
Yeah, a little piece of positivity there, of optimism, goes a long way. But like you say, we have to be careful. We have to keep these mitigation procedures in place. Of course, the face masks are essential too, and some are resisting them. But like you say, that's going to prevent those droplets from being passed from one person to another. There's really so much to talk about, and I'm sure a lot of people are leaning on you in your expertise and in your knowledge. So thank you for everything that you're doing, and please communicate that to your team.
I think of the healthcare workers who are out there on the front line and the other essential workers who are putting themselves at risk for the rest of us, and they're the ones to really thank.
Well, thank you to them, and thank you to you as well, Doctor. Thanks for joining us. And to learn more about any of the coronavirus-related information we talked about today, including other resources available to you, there's really so much to learn. You can visit pima.gov/COVID-19.